Welcome to the official YouTube channel of Al-Biruni Institute of Medical and Health Sciences, Hyderabad. In today's session, we will be discussing the management guidelines of the spine. This lecture has been prepared by Dr. Rahila Soomro and focuses on the essential principles, evaluation techniques, diagnostic categories, and effective management strategies for various spinal conditions. By the end of this session, you will gain a comprehensive understanding of how to examine, diagnose, and manage spinal problems using evidence-based clinical approaches for better patient outcomes. Principles of management. The management of spinal conditions begins with a thorough examination and evaluation of the patient. A detailed history, systems review, and clinical testing are crucial for identifying the underlying cause of symptoms. During history taking, it is important to rule out red flag signs, which may indicate serious medical conditions requiring immediate attention. Neurological symptoms must be carefully assessed to determine whether they originate from the spinal cord, nerve roots, spinal nerves, plexus, or peripheral nerves. Additionally, understanding the pain patterns helps differentiate between musculoskeletal disorders and other systemic medical conditions, ensuring that the treatment plan is tailored to the patient's specific needs. Stages of recovery. Spinal problems progress through three main stages of recovery, and treatment strategies must be adapted accordingly. The acute stage lasts less than 4 weeks and is often characterized by constant pain and signs of inflammation. In this phase, patients may find it difficult to achieve relief in any position. The subacute stage, lasting from 4 to 12 weeks, involves intermittent symptoms typically linked to mechanical deformation. Patients at this stage may have difficulty standing for more than 15 minutes, sitting beyond 30 minutes, or walking farther than a quarter mile without worsening symptoms. The chronic stage begins after 12 weeks and is focused on helping patients restore function and return to normal or high-level activities. In cases of chronic pain syndromes lasting longer than 6 months, management becomes more complex and often requires a multidisciplinary approach. Impairment-based diagnostic approach. Management strategies for spinal disorders are guided by impairment-based diagnostic categories, which help in selecting appropriate interventions. Patients in the acute stage with inflammation present with constant pain and swelling, requiring protective strategies and symptom relief. Those with acute conditions without inflammation may have intermittent, mechanically induced symptoms that respond well to positional adjustments. In the subacute and chronic stages, the focus shifts toward regaining mobility, improving strength, and restoring overall functional capacity. Additionally, spinal disorders are often classified based on movement bias patterns. Patients with a non-weight-bearing bias are more comfortable lying down, and traction therapy often provides relief. Those with an extension bias benefit from postures and exercises that encourage spinal extension, while patients with a flexion bias find relief by bending forward. Individuals with hypermobility or functional instability require stabilization techniques to improve spinal control, whereas hypomobility is managed with mobilization or manipulation. Similarly, muscle and soft tissue lesions respond well to exercise therapy, and postural pain syndromes are managed by posture correction, strengthening, and conditioning. Acute spinal impairments. Protection phase. In the acute phase, the primary goal is to reduce pain, control inflammation, and protect the spine while preventing further injury. Management involves patient education, safe posture training, and gentle activation of stabilizing muscles. Techniques such as traction, massage, mobilization, and bracing may be used to relieve symptoms. Patients are guided in kinesthetic training to improve awareness of cervical, scapular, and pelvic positions. Deep segmental muscle activation techniques, such as the drawing-in maneuver for the lumbar spine and gentle head nods for the cervical spine, are initiated early. Gradual practice of safe sitting, standing, and walking positions helps patients regain mobility while maintaining spinal protection. Subacute spinal problems. Controlled motion phase. The subacute phase focuses on improving mobility, enhancing neuromuscular control, and restoring strength and endurance. At this stage, patients often experience less pain, which allows for more active rehabilitation. Emphasis is placed on improving postural awareness, increasing flexibility, and retraining stabilizing muscles. Patients are educated on safe body mechanics, functional adaptations, and proper ergonomic adjustments in daily activities. Interventions include home exercise programs, spinal stabilization exercises, progressive stretching, aerobic conditioning, and relaxation techniques to manage stress-related muscle tension. By gradually increasing tolerance to activity, patients develop better control over spinal alignment and movement. Chronic spinal problems. Return to function phase. In the chronic stage, management focuses on restoring functional independence and preparing patients for high-demand physical activities. The goals are to improve dynamic trunk strength, flexibility, and endurance while addressing any muscular imbalances. Functional rehabilitation emphasizes neuromuscular control, balance, coordination, and agility to help patients return to their daily and recreational activities. Treatment may include progressive resistance training, aerobic conditioning, joint mobilization, ergonomic modifications, and activity-specific training. Patients are encouraged to develop long-term self-management strategies, adopt healthy exercise habits, and practice techniques to reduce stress on the spine. Special management approaches. Some patients require condition-specific management techniques depending on their clinical presentation. Traction therapy helps relieve pressure on nerves, improves blood circulation, and reduces compression in the spinal structures. For patients with an extension bias, postures and exercises encouraging spinal extension can centralize symptoms and improve function, especially in cases of disc herniation. Those with a flexion bias, such as patients with spinal stenosis or spondylosis, benefit from forward bending positions and flexion-based exercises. Lateral shift corrections are performed manually to realign the thorax and pelvis. Additionally, kinesthetic training improves spinal movement awareness, while stabilization programs strengthen the deep segmental muscles, including the multifidus and transversus abdominis, to enhance spinal stability. Management of specific spinal conditions. Several spinal disorders require targeted management strategies. Vertebral compression fractures, VCFs. These occur when the vertebral body collapses, often due to osteoporosis or trauma, resulting in severe pain, deformity, and reduced mobility. Management involves extension-based therapy, posture training, core strengthening, and spinal stabilization. Spondylolisthesis, a condition where one vertebra slips forward over another, causing back pain, nerve compression, and sometimes neurological deficits. Treatment includes bracing, anti-inflammatory medications, traction, and physiotherapy focused on core stability and flexibility. Ankylosing spondylitis, a chronic inflammatory disease leading to spinal fusion and decreased flexibility. Management includes posture correction, extension-based exercises, mobility training, and relaxation techniques to maintain functional independence. Tension and cervical headaches. These headaches often arise from musculoskeletal dysfunction, poor posture, or cervical spine impairments. Treatment involves postural education, cervical stabilization, gentle stretching, stress management techniques, and relaxation exercises. Conclusion. The management of spinal conditions requires a comprehensive, stage-specific, and patient-centered approach. From early protection and pain relief in the acute phase to functional restoration in the chronic stage, each step involves precise assessment, targeted interventions, and ongoing patient education. By combining proper diagnosis with evidence-based rehabilitation techniques, we can help patients reduce pain, improve mobility, and regain optimal spinal health. Thank you for joining this session on management guidelines of the spine. If you have any questions regarding today's topic, please feel free to write them in the comment section below, and we will be happy to respond. Also, don't forget to like, share, and subscribe to Al-Biruni official YouTube channel for more informative medical sessions and updates. Dr. Rahila Soomro, signing off.